Good morning, everyone. Today we will learn about the types of recording and forms of the recording. So there are different forms for keeping recording safe. Okay. Yesterday we already learned for the methods of the documentation. Now today we will discuss about the forms of keeping record. So how we can save or how we can keep recording our data. So there are different forms for recording data, like first of all Cardex method, second one flow sheet, third one nurses progress note, and fourth one that is the discharge summary. So we will learn and discuss this all kind of the form of recording data. So first of all, Cardex. So what is the meaning of Cardex? It is a use for reference throughout shift and during change of shift report. We already discussed the types of report in that change of shift report, incident report, okay, anecdotal report. So the Cardex is a use for a reference tool throughout the shift report or change of shift report. Like in that we include this kind of the data. First of all, client baseline data like name, age, admission date, OPD number, IPD number, any allergic reaction, chief complaint of the patient, etc. So first point, that is the client data, will be included in this form. Second one, medical diagnosis and nursing diagnosis, means what doctor diagnosed to the patient according to the chief complaint. So we will record that medical diagnosis, and according to the doctor medical diagnosis, nurses plan the nursing diagnosis, okay, and plan the care of the patient. So medical diagnosis and nursing diagnosis. Third one, medical orders. So what doctor prescribed into the treatment plan for the patient. So check the medical orders and list of medicines also, like IV fluid or oral medication. Okay, how much amount, how much dose of the medication. So at proper time. So these all things are keep in form of the Cardex, and activities and diagnostic test or specific data of the patients. Like before giving any treatment or any medication, we should check diagnostic evaluation of the particular patient, specific data, like if any specific investigation is there, then after we can provide medication to the patient. So these all are included into the Cardex form of recording data. So it provides a concise method of the organization and recording data about the client and making information readily accessible to all members of the healthcare team. Okay, so this kind of the Cardex form will keep easy for making the organizing data and all gather information of the particular patient, and also can discuss with the healthcare team member. So we can discuss the patient's history or patient treatment with the other healthcare team members. So it is a series of flip card usually kept in portable file. Means this method is very easy to carry, and the series of flip card which is kept into the portable file. It is a way to ensure continuity care of the patient from one shift to another and from one day to the next day. So in change of shift report also, this method is very helpful for the continue giving care to the particular patient, and it is a tool for the change of shift report, but endorsement is not simply reciting content of the Cardex. So healthcare needs of the client is still primary basis of the endorsement. Okay, so this is a main tool for the change of shift report, and we can keep it safe and easy form. In Cardex, these kind of the data should be included in this format, like client's baseline data, personal data, basic need of the patient, any allergic reaction is there or not, diagnostic test, daily nursing procedure which is followed by the different staff member or nurses, medication like IV, oral, blood transfusion, etc. Treatment like O2 therapy, steam inhalation, suctioning, change of dressing, mechanical ventilation. Okay, so these kind of the all data should be mentioned into the Cardex form, means summarization form. An entry is usually written in pencil, and this implies the Cardex is for planning and communication purpose only. So the main purpose of this method is communication, and we can keep with us safely. Okay. Second point, that is the flow sheet. Second form of the recording data, that is the flow sheet. So in this format, the information on flow sheet can be formatted to the meet the specific need of the client. Okay, like in graphical sheet for the vital signs, intake output chart, skin assessment. So like this kind of the tool we can create into the flow sheet form. So it will be easy for recognizing all data. Okay. Third form, that is the nurse's progress note. We all know that what is the nurse's progress note. During giving the after giving the treatment or any medication to the patient, we plan a note and mention into the all record, like patient vital signs, temperature will be 98-degree, pulse will be this, respiration will be. So we can keep it record with us as a nurse. So use the document tool of the client's condition, problems, complaints, intervention, responses, achievements of an outcome also. So it will be solid evidence for the patient also and for the authority also. So as a nurse, we have to accountable, or we have to keep a nurse's progress note of daily with date and time and signature mentioned. Okay, so this is the easy form. And in nurse's note also, this kind of the data should be included, like personal data of the patient, basic need, allergies, diagnostic test, daily nursing procedure, medication, IV therapy, blood transfusion, treatment like O2 therapy, steam inhalation, suctioning, change of dressing, mechanical ventilation, because this kind of the minor things also can create a major problem in future. So we have to keep record of the all these things. Okay, after giving treatment also outcome, we have to mention into the nurse's progress note, so it will be easy for us. Okay, entries should usually written in pencil, so it implies into the cardex for planning and communication also. Okay, so main purpose is the planning and communication of these format also. Last form of the recording data, that is the discharge summary. So this is the most important. Admission and discharge, both process are very important throughout the patient's discharge. So in discharge summary, we have to keep client status at admission and client status at discharge time. Okay, date, time all should be mentioned into that summary. Brief summary of the client's care means during the whole period of hospital staying, how patient can treat and how they feel better, and now they take a discharge from the hospital. So whole brief summary, what treatment ongoing, day by day progress of the patient, all should be mentioned into the discharge summary. Then intervention and education outcomes also. Okay, so how we provide a quality care of the patient, then how educational outcome means awareness into the patient come, resolve problem and continuity need. Okay, so we listening problem of the patient can best try to the treatment and best try for the outcome and resolve the problems of the particular patient, any referrals and client's instruction. Okay, so these all should be mentioned into the discharge summary, so that we have keep record into the hospital side also and patient also. Okay, so these all are the forms of the recording data. Then common ward record. There are many records we have to keep into the hospital side. Okay. So in common ward record, these kind of the records should be mentioned by the hospital committees. First of all, that is the patient clinical record, means how patient get treatment, what kind of the medication given to the patient, what kind of the nursing procedure given by the staff. Okay, So patient clinical record, staff attendance record means how many staffs present into the morning shift, how many into the evening and night time. So the attendance record of the staff also maintained, and leave record of the staff also maintained into the hospital side. Staff patient assignment record means daily assignment of the staff patient, like staff explain the some new things to the patient, and patient also learn from staff. Okay, staff also learn from the patient. So this is the assignment record between the staff and patient. Then student attendance and patient assignment record. Okay, student attendance also mentioned into the hospital side, and patient attendance assignment record. Then ward indent record. What is indent? Means daily stock available into the ward or not, how much number of the needles, number of the IV fluids, okay, medication are indent into the ward, okay, how much use from that indent. So this is the indent record we should keep into the ward record. Ward inventory record also, okay, same as the indent. Equipment maintenance record means like ET tube, flatus tube, okay, enema can, then steam inhalation, how much equipment present into the ward side. As an example, એક વોર્ડમાંથી બીજા વોર્ડમાં બીપી ઇન્સ્ટ્રુમેન્ટ લઈ ગયું, ઓકે, ટેમ્પરેચર માટે થર્મોમીટર લઈ ગયું, તો આપણા વોર્ડમાંથી બીજા વોર્ડમાં ગયું છે એનો બી આપણી પાસે રેકોર્ડ હોવો જોઈએ, અને પાછું લેવા માટે બી એની પ્રોસેસ કરવાની, કે એવું ના થાય કે આપણા વોર્ડની વસ્તુ ત્યાં રહી જાય. સો ઇક્વિપમેન્ટ અને જે ઇન્વેન્ટરી રેકોર્ડ છે એ બંને તમારે ડેલી ને ડેલી ચેક કરતું રહેવું પડે, કે જેથી કરીને કોઈ મિસિંગ હોય અથવા કોઈ એરર આવે તો આપણને એટ એ ટાઈમ એનો રિપોર્ટ મળે. Okay, so that is the equipment maintenance record. Then ward incident record means any incident occur into the ward side for patient or for any staff, then it should be maintained into the ward incident record. Then infection surveillance record, okay, for the prevention of infection we should keep a record of the infection surveillance. Then ward quality indicator record, okay, ward diet supply record, emergency drug crash cart trolley, so how much medication are used into the ward per day. Patient admission, discharge and shift record, this is maintained into the every ward daily, okay, how much patient into the today, how much in how much patient today present into the particular ward, okay, how much admission is there, discharge from one ward to another or shift from one ward to another ward. So this all kind of the record should be maintained into the every wards and hospital side. Okay, according to policy it may be variated from one place to another, but common ward records should be mentioned at every hospital or clinical setting. So this will be helpful to the staff members also, hospital committee member also, and for patient safety also. These all are very important. So okay, this is about the documentation. So forms of the recording data. So if you find any doubt, you may notify to me. Okay, thank you everyone.